I want to begin with your universal health care plan. Paul Krugman praises you in his column today for being the only candidate to get really specific about this. And as I understand it from what I've read, you would include employer mandates, that is employer coverage, or employers would have to pay into a fund. Community rating, no different rates for people who are sicker or older.
Yes.
You would group people into what you call health markets so they could negotiate more effectively with insurance companies. Do you also have individual mandates like the Schwarzenegger plan or the Massachusetts plan?
Yes, there is if I can sort of do a quick, just big picture, basically the plan is built on the idea of shared responsibility. Employers, as you point out, have to either cover their employees or pay into a fund. The government will set up healthcare markets around the country, which will provide choices to both business and individuals if you're not employed or small business. Those choices include private insurers, but also include a single-payer government plan, Medicare Plus. So if people who are in favor of single payer, they may choose the government plan, and it could actually gravitate in that direction depending on what people actually choose. There is an individual mandate; everyone has to have health insurance, but the government also subsidizes the cost of health care. Low-income families completely subsidized, and basically the subsidy goes down as your income level goes up. And we fill in the gaps in the health care system. There's complete mental health parity, mental health treated just like physical health, chronic care, mandatory preventative care, so we cost contain, long-term care is also covered. And then finally, the issue of job lock is affected dramatically by this, because if you have your insurance, either a government plan or a private insurer in one of these health markets, and you change employers or lose your job, you can take your insurance with you.
Explain the health markets a little more.
Basically, what the whole idea is to set up both market power and efficiencies that don't presently exist. So the government will take competitive bids from the private insurers. As I mentioned earlier, there will be a government plan that's basically a Medicare Plus plan. But the private insurers and the most competitive bids will be the ones allowed into the market, so that it's not like these big employers have that kind of market power now. But small employers don't, individuals don't. And it mandates lower administrative costs, mandates the use of technology in these health markets, mandates the use of technology, mandates electronic record keeping. So we no longer have the problems with medical mistakes because of bad records. So it both has cost containment, gives people choices, and brings down creates efficiencies that don't exist.
So some of our listeners who are Democrats are going to say, well, that's a valiant effort to cover everybody through this patchwork kind of system, but it's got so many moving parts. Why not just go to single payer?
Because what I've learned in the last few years while I've been working on this issue is there are a lot of Americans who want single payer, and there's a good reason for that. Single payer has huge advantages, much lower administrative costs. I mean, we spend 30 to 40% of healthcare dollars on administrative costs. In the Medicare system, it's about 3%. So that's a big plus. But there are a lot of people who don't like the idea of not having choices. And there are some who, even good Democrats, who are nervous about the government being solely responsible for health care in the aftermath of what we saw in Katrina. So all those are legitimate concerns. What I wanted to do is set up a system where if Americans decide that single payer is what they actually want, they're going to vote with their choice. In other words, if
they'll all sign up for the government plan.
Correct. I mean, it may be that a significant number sign up to begin with, and that becomes the most popular, most efficient plan, and people gravitate in that direction, in which case it could move to single payer.
So for better or worse, you would have the government actually competing with private insurers for individuals to sign up.
Correct. That's exactly right.
Before we get off healthcare, the Krugman column today also said that you have come down on the side of deficits not mattering as much as covering everybody with health care. And he was praising you for that. You said you would raise taxes. That is, you would undo the president's tax cuts on the wealthiest Americans in order to pay for this. But it also means, according to Krugman, that you think we don't have to get to zero deficit as quickly. Was he right?
He is right. He, to his credit, he completely understands what I've said and my positions. I don't. I think there are three categories of people about deficits. One group thinks they're completely unimportant. I think that group, unfortunately, would include this president. One group thinks they are the single greatest priority, elimination of deficits. And then I would put myself in the third category. I do think deficits matter. And I am committed to not raising the deficit and finding ways to reduce it. But to me, they don't matter as much as providing universal health care, transformational change in the way we use energy, strengthen the middle class, lifting people out of poverty. And I have lots of ideas on all those fronts. So you have to, and I am concerned. I hope that voters are listening really carefully to candidates who use a lot of rhetoric about universal health care, but don't give a real plan, a detailed plan, and don't to say how they're going to pay for it. Because I do not absolutely, anybody who says we're going to we're going to eliminate the deficit and provide universal health care, and we're not going to change the tax system, it can't be done.
There is a critique to be done, though, of using deficit spending to provide universal health care.
Of course.
And that critique is you're supposed to use deficits like a mortgage for, building the basis of something, not for ongoing year-to-year operating expenses like universal health coverage would be. So why wouldn't we get deeper and deeper into debt if you're willing to use deficit spending for that?
It's a good question. First of all, you have to make a judgment on the front end about both morally and economically what's in America's long-term interest. My belief is that structurally we strengthen the economy, grow the economy by dealing with the competitiveness problems with our healthcare system, which are very serious, and the problems that it creates for ordinary Americans. Especially when that's combined with the transformation of the way we use energy, then I believe that grows the American economy over time. Growth of the American economy reduces deficits. And so I think this is actually a structural, transformational change necessary for America to be able to be competitive.